The 22nd of June, 2019 is a day that I'll never forget. My day started off as normal. I woke up, had a shower, brushed my teeth, and jumped on my bike, ready for my day of work. I set off through Kitsilano, one of Vancouver's many lovely residential neighborhoods. I made my way down to the seawall and up and over into Vancouver's downtown financial district. Here, I was surrounded by beautiful glass, high-rise buildings, luxury sports cars, and designer stores. And then I arrived in Gastown. In Gastown, I passed by a range of artisan and luxury art galleries, funky underground bars, and boutique restaurants. And then I arrived at Carroll Street. Carroll Street marks the edge between Gastown and the downtown east side, often referred to as Canada's poorest area code, which for the past decade has been the epicenter of Canada's overdose crisis. So this particular morning, I turned onto Carroll Street and I immediately noticed a man lying in the doorway to an apartment building on the corner of the block. The doorway was well lit, and from my vantage point of about 20 meters away, I could immediately tell that something wasn't right. The man was laying flat on his back with his head looking straight up into the sky. He was wearing blue jeans and a white vest and had a few shopping bags on the ground next to him. From my vantage point of about 20 meters away, as I approached, I saw 4 or 5 people walk directly past him, 2 stepping over his legs as they did so. So I biked over, I jumped off my bike, and I knelt down next to him. The man's breathing was incredibly shallow, breathing once every 10 to 12 seconds, and his face was pale white, with his lips being blue verging on purple. So I started shaking him, desperately trying to wake him up, and it was at that point that I noticed 2 syringes lying on the ground tucked into the doorway behind him. So I got out my phone, I dialed 911, and I put it on speaker and left it beside me. I then got out my naloxone kit. Naloxone is an incredibly powerful drug, which when injected can immediately reverse opioid overdoses. So I took out the 3 vials that I had on me, and I began injecting him. After about 90 seconds, still nothing had changed about his condition, and so dispatch told me to start doing chest compressions and giving him breaths. So I started doing that, and thankfully, within about a minute, he started to regain color in his face, and his breathing started to become more regular. He still hadn't regained consciousness, but within 3 to 4 minutes, an ambulance was on the scene, and they took over, ultimately saving his life. The scene I've just described was my first time responding to an overdose by myself in Vancouver. Today, in Vancouver, an average of 5 people die because of overdose. And province-wide, since the beginning of the COVID pandemic, overdose deaths have taken more lives than car crashes, homicides, suicides, and COVID-19 deaths combined. On April 14, 2016, in response to an unprecedented rise in overdoses, BC's provincial health officer declared a public health emergency. Since then, since 2016, over 14,500 Canadians have died because of fatal overdoses. These spike in overdoses have been due to the introduction of a new and extremely potent opioid called fentanyl. Fentanyl is up to 50 times stronger than morphine, and due to its low cost of production, dealers are cutting it into virtually all street drugs. Today, in Vancouver and nationwide, both those who are using drugs recreationally and those who are going through addictions are playing Russian roulette with their lives every single time they use. So, what is being done in Canada to stop this? Well, in response to these alarming numbers, both provincial and federal governments have implemented harm reduction interventions into communities most heavily impacted by overdose. In relation to drug use, harm reduction describes the policies, programs, and practices that aim to minimize the negative effects of drug use, be that health, social, or legal. This progressive policy stance recognizes that many people are unable to stop using drugs, and regardless of this fact, deserve to be kept alive. Harm reduction neither promotes nor denounces drug use, but solely looks to support people and help with the problems associated with it. In Vancouver, the first kind of major form of harm reduction was seen through needle exchange programs. In the 80s and 90s, this original intervention curbed Vancouver's HIV epidemic, where again, the downtown east side displayed some of the highest rates of infection of anywhere in the Western world. Being deployed at an extremely low cost, and by eliminating the need for injection drug use to Scher needles, public health agencies were able to significantly reduce the number of infections within the community. In 2003, Canada took its next step in implementing progressive forms of harm reduction. In a landmark case, the BC provincial government challenged the federal government, allowing for the opening of Insight, Canada's first legal supervised consumption sites. Supervised consumption sites are centres where people can bring in drugs and use under the supervision of healthcare professionals and peers. This supervision significantly reduces the risks associated with injection drug use, including the spread of bloodborne diseases, as well as potential injuries from unsafe and unsanitary using environments. Instead of this, drug users were provided with this. Undoubtedly, however, the strength of supervised consumption sites lie in their ability to save lives. With healthcare professionals there to monitor people using drugs, they can immediately respond to overdoses and reverse the fatal symptoms before it gets anywhere near to how serious it would be outside of the facility. Worldwide, there are over 100 sites in operation in 60 cities and 11 countries, and not one death has ever occurred. Last year in Canada, over 5,500 people died from overdose. However, the BC Centre for Disease Control suggests that this number would be doubled, around 10,000, if consumption sites had not been introduced. To me, this is simply remarkable and shows the value that supervised consumption sites can have within communities. To me, this fact alone, the fact that it saves so many lives, should be the only thing that legitimizes its implementation. Now, some of you might be wondering, is this moral? Is this not simply enabling drug use? Should we not be trying to get people off of drugs? Well, despite what many critics think, the research shows that they do. Research from Vancouver, Munich, Sydney, Copenhagen, Berlin, and Paris all show the same thing. When someone has access to a supervised consumption site, for as little as 1 year, they show a 30% increased chance of getting into recovery and accessing detox. Now, this may come as a surprise, but what the research shows us is that these sites are accessing our most vulnerable and most marginalized community members. Those in our community who to date have had little to no contact with healthcare providers or mental health services. These are members of our communities who are used to being stigmatized. However, in supervised consumption sites, they get treated with compassion in a non-judgmental environment, which for many is the first time that this has happened. You see, non-judgmental care creates trust. It creates trust in a system which for many has let them down. A system which for many has let them slip through the cracks of early intervention healthcare and housing support. And to be honest, has probably alienated them completely from wanting to receive services. Supervised consumption sites break the cycle. Now, what the overdose crisis has taught us is despite the effectiveness of consumption sites, they have simply not been enough to treat this issue entirely. What this overdose crisis has taught us is that drug policy is incredibly complex, and this situation is going to require bold, simultaneous, progressive, and sometimes controversial solutions. Now more than ever, we need to implement drug policies based on the evidence. So, what is the evidence? Well, the answer and the clear next step in drug policy is that we need to be providing a safe, regulated, prescription-based supply of opioids for those going through addiction. Now, this may sound controversial, but the thing is, we have done it before. During alcohol prohibition in the United States, rates of crime went up 20% and rates of addiction rose by 40%. Additionally, yearly up to 10,000 people died from alcohol poisoning as a result of moonshine and other unregulated alcohols. What did we do? Once we knew the dangers of alcohol consumption, we regulated it and we provided a safe alternative for the consumer. Now, logically, opioid regulation will look much different to that of alcohol. But the thing is, the logic behind it is exactly the same. Just like any other approach to a mass poisoning, a public health approach that is, you immediately cut out the poison by providing a safe alternative. Last year in Canada, like I said, 5,500 people died from opioid poisoning. And in the US, the fentanyl-tainted drug supply took the lives of up to 70,000 people. It's clear that we need to be cutting out fentanyl and cutting out this poison. So, what is the evidence around offering a prescription-based supply of safe opioids? Well, trial studies from Portugal, Switzerland, the UK, and now Canada have been remarkable. These studies have shown that for the cohorts that have had access to a safe supply, their lives quickly change for the better. See, in practice, prescription opioids get dispensed by doctors at regular times throughout the day, creating a structure. And with routine set around their drug consumption, people going through opioid addiction are able to spend more time on productive activities, such as getting job training, spending more time with their friends and family, or seeking housing. The most recent study we have is from a study in the UK. In the Middlesbrough Safe Supply program, patients showed a 90% drop in criminal activity and raises of up to 396% in perceived mental and physical health. These statistics represent the visible benefits to both individuals and communities as people's drug intake is removed from the chaos of the streets, which comes from a black market supply. When we factor in the toll on our healthcare system, the toll on our policing system, and the toll on our criminal justice system, the Canadian Centre for Substance Use and Addiction estimates that the toll on our society every year comes to around $3.5 billion. Implementing a safe supply would not only save lives, but it would significantly cut into this number. In order for this to work, we need to ensure that governments are committed to simultaneous investment in affordable housing and in addiction treatment centres. But the harsh reality is that for our friends, families, and our wider community members going through opioid addiction, they cannot seek recovery if they are not alive to do so. We need to remove the fear around drugs, and we need to remove the stigma around those who use them. We need to listen to the experts who have now been researching for decades and in some places implementing evidence-based policies that work not only for individuals, but for the wider community as well. In the words of the great Mahatma Gandhi, the true measure of any society can be found in how it treats its most vulnerable members. Today, that statement holds true. People are dying unnecessarily. We need to take action, and we need to show through both financial investment and through policy, regardless of a person's drug use, we are going to support them. We need to show that we care, and ensuring a safe supply does exactly that. Thank you.